Okay, guys. So today we're going to finish up talking about measuring vital signs. And we're going to talk about the fifth vital sign, as some people refer to it, which is assessing pain level. Your objectives at the completion of this lecture would be to be able, with at least 70% accuracy, to define what is pain. Okay? 4 types of pain. Explain why pain is subjective. Demonstrate how to use a pain assessment scale. And tell me at least 3 nursing measures you can do to help relieve pain. So, pain, the phrase pain as the fifth vital sign was initially promoted by the American Pain Society. Did you all know there was an American Pain Society? Well, you know now, right? To elevate awareness of pain treatment among healthcare professionals. Vital signs are taken seriously. If pain were assessed with the same zeal as other vital signs are, it would have a much better chance of being treated properly. We need to train doctors and nurses to treat pain as a vital sign. Quality care means that pain is measured and treated, and this comes from Dr. James Campbell, who's actually the president of the American Pain Society. So I know that you all saw the little square of paper that was laying in front of you. What I want you to do with that piece of paper, you're going to use one word. And that one word that you're going to write down there is to describe the worst pain that you've ever had in your life, or the worst pain you can possibly imagine. Using one word to tell me what that pain was, how you would have described it to me. Using one word, okay? And after you all do that, I'm going to come around and collect those, and we're going to put them in this little cup. All right, so take just a few seconds here and write down your word to describe. One word, please. One word. That is correct. One word. There is a purpose. I assure you, there is a purpose for this. Describe your pain using one word. Nah, it doesn't matter. Still thinking? Still thinking? Still thinking? Okay. Thank you. Evan, I think I can get yours. You already got it?
Yeah.
Fold it in half, please. Alrighty. Devin, I guess since you're videotaping, we won't make you have to write down something on a piece of paper, will we?
Why do you say that?
Thank you. There is not a right or wrong answer. Okay? Was that easy? Was that an easy thing for me to ask you to do? That was kind of difficult, wasn't it? All right. Well, there's a purpose to it. We're going to set that there and come back to it. All right, so the definition, if you looked it up in a dictionary for pain, would probably be something along these lines. An unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. So did anybody write pleasant for their word? No, I don't think you did you? It is unpleasant. Sensory means what to you? That you can feel it, okay? Feel it physically, or you might even feel it emotionally, because you can have an emotional pain as well as a physical pain. And it tells our body there is actual damage going on, or we have the potential for some kind of damage. So pain is a warning sign. When you have pain, it's your body saying, hey, something is not right here. It's warning you. Okay, this will work. Subjective versus objective. In previous lessons, we have talked about subjective data versus objective data. And just to refresh your memory on that, objective data is what you can observe. You can see if it's objective. Subjective data means this is what your patient is telling you. So, I, right now, have a headache. Can you see my headache? So is that subjective or objective? Subjective. So the point I'm trying to make for you is that pain is always subjective. It is what the patient tells you it is. I do have a headache right now. It hurts pretty bad. I think I have a sinus problem. But that is subjective. I'm really not demonstrating to you that I have pain, correct? Now, I might show some signs of pain if I were sitting here at my desk and doing something. I might be going, all right, is this subjective or objective? Objective. But yet, can you see my pain? You can see that I have a symptom of pain. I'm holding my head. I was making a face. So you've got to remember, you may see outward signs of pain and you may not, depending on the person and what's going on. But their pain is subjective. It is what they say it is. So, when we're talking to our patients and we're assessing their pain, there's different things that we're going to assess, such as the intensity. And the intensity would be something like, is it mild? Is it moderate? Is it severe? Is it debilitating? Because, you know, my pain right now, I'd say it's mild to moderate. If it were severe to debilitating, I would be at home in my bed. So it makes a difference on the intensity. Quality would be like, is it a continuous pain? Does it come and go? Is it intermittent? Or is it throbbing? Is it aching? Is it stabbing? Is it sharp? Is it burning? There's lots of different ways that we can describe quality. And I bet whenever we pull out your little pieces of paper in just a minute and look at them, a lot of you probably wrote down something that has to do with the quality of the pain whenever you describe it. But we've already established it's kind of difficult to describe pain. The location, you know, is it your head? Is it your foot? You know, where is it at? The timing. When does it start? When does it stop? How long does it last? Well, that's kind of duration, which is the next. When the pain comes, how long does it last? Does it last for a day? Does it last for an hour? Does it last for a second? And aggravating or relieving factors. My headache right now is aggravated by the fact that I'm talking. Okay, whenever I'm sitting down quiet and the lights are dimmed, it helps. That's relieving to me. So it's going to be different for every patient. But we want to get a thorough description and assessment of their pain. Because it is so difficult for some people to describe pain to you, some people can't speak. Maybe they've had a stroke and it's made them nonverbal. They may not be able to tell you. Kids sometimes have a really hard time describing pain to you. So for that reason, there are several visual images that you can use to assess someone's pain level. And these are just some little things that I printed out, and y'all can look at them and pass them around, okay? These are different kinds of pain assessment tools. Now, on this particular scale, we start at 0, which means no pain, and we go up to 10, which is the worst pain that is possibly imaginable. So if you really couldn't describe your pain to me, and I showed you this scale, you could pick a number. If you pointed at 7, I'd know you had pretty good pain. If you pointed at 1 or 2, then it's probably a tolerable amount of pain. But for some people, no amount of pain is tolerable. So this is something easy to reproduce, something that everybody can use. This one is actually my favorite for kids. Whenever I worked in the school system with kids, they would have a really hard time explaining their pain to me. So if I showed them this and asked them to point, which one of these faces would tell, Miss Buffy, that's what they called me, which one of these would tell me how you felt right now? So they could look at those faces and very easily point to one and tell me their pain. This one is actually my all-time favorite. If I was still working as a nurse in a hospital, this is something that I would want to have laminated and keep on my clipboard with me all the time, because it breaks it down in different languages, from Japanese to Spanish. No pain, alert and smiling. Pain can be ignored, interferes with tasks, etc., etc. But as you see, it still goes across 0 to 10. So pain scales are a very easy thing that we can use to assess pain. Alrighty, before we run out of time here, let's talk about different kinds of pain. Acute, we've talked about how acute pain, or acute means to come on suddenly. An example of that may be a hip fracture. Chronic pain, something that's been there for a long time. There's damage to the body already. Radiating pain. My pain may be because I'm having a myocardial infarction or a heart attack, but generally the pain's not right here in the center of my chest. It travels outward. The next one is phantom pain. Even when you have a body part removed, it is possible to still feel pain in that area. How am I doing on time?